No worries. Just appreciate your presence. Okay, give me 1 second. Okay, so let me just pull up my notes here. Okay, so good evening, everybody that is here in attendance. I want to first, of course, introduce myself and then allow for Michael to introduce himself as well. But before we do that, just to kind of make sure you guys are in the right webinar, this is the herbal remedies or prescription medication for your mental health needs, right? So just a conversation about a lot of different things regarding herbal remedies and prescription medication, which might be best for you, both, neither, and just tailoring that conversation. So my name is Renee Anorue. I am a licensed clinical social worker / therapist, psychotherapist, however you want to call it. I am the founder of Core Psychotherapy, which is a outpatient mental health private practice that has been up and running for about 4 years now. And I work with clients around a lot of mental health concerns, whether it's anxiety, depression, PTSD, trauma, life transitions, grief, things of that nature, as well as offering a lot of herbal products. I do have a line of herbal products, wellness products, including teas, tinctures, things of that nature. And I also have been a speaker and consultant in some spaces. So that is a little bit about me. Michael, if you want to go ahead and give a little introduction as to who you are.
Sure. So I'm Michael Lievers, residency trained pharmacist with a background in clinical research, healthcare technology, acute care, and in addition in mental health now, working under IntoTouch Wellness as their psychotropic pharmacist to kind of answer any questions and to help, guide any of our patients with any of their medication needs.
Mm-hmm. And so just to kind of speak briefly about how this conversation came about. So myself and Camilla Jones, who she didn't necessarily introduce herself, but she is the founder of IntoTouch Wellness. She and I met, I want to say a couple months back at a wellness conference in Maryland. And we just got to talking with my clinical background and her background in pharmaceuticals about the barriers, the misinformation, just all this stuff when it comes to herbs, medication, the benefits, importance of both, and everyone's misinformation, like I said before, right? So we kind of figured it would be helpful to have just a general conversation to give that correct, accurate information from a clinical therapist standpoint, but also from the medical standpoint from pharmacists, right? And so we wanted to make sure that we're having a very culturally informed conversation to be able to empower people of color and communities of color with not only the science behind the medication that they may be taking, but also ancestral wellness tools as well. Okay, now we are very familiar with the fact that there is a stigma around people of color when it comes to mental health, taking medication specifically for your mental health needs, and needing help necessarily, right? What that could look like. Are you weak? Is there something wrong with you? Are you crazy? The list goes on, which we'll get more into that in a little bit. And we want to kind of like debunk some of that stuff. We want to demystify some of that stuff. We want to be able to, again, give clinical and educational expertise around a lot of the things that people may have questions about when it comes to herbs and or medication. Okay, so before we get into any specific topics, I do want to say that this conversation is not a one-size-fits-all conversation, right? So what may be good for one person may not be, the same approach for a different person. So it's really just about getting information from both Michael and myself to be able to make an informed decision based off of the information that we give, as well as follow-up that you may get from a healthcare provider. Okay, so again, we're going to explore both herbs and prescription medication without really bashing or shaming either route, just kind of determining which might be the best route for you, depending on what is currently going on for you. Okay, now before we start getting into topics, I did want to I'll ask the question, just give a little poll just to kind of gauge the audience and see where you guys are at. So when it comes to mental health support, where would you say that you typically lean towards? Would you say, and you can either say your answer out loud or you can write it in the chat. Would you say that you're mostly you take herbs and natural remedies to kind of help with your mental health? Would you say mostly medication? Would you say a mixture of both? Or would you say, I don't even know where I stand, I'm not sure, I'm still trying to figure it out? So if anyone wants to take themselves off of mute and respond, or if you want to write your answer in the chat.
So, you know, I'll say for myself, you know, for me, it's probably a mix of both, even as a pharmacist and, you know, from a clinical background, that stigma of healthcare and, you know, having that trust in healthcare providers and so forth, even as a healthcare provider myself, it's real, it's valid. So even myself, I'll say it's a mix of both.
I'll add to that as a pharmacist, right? Pharmacist and therapist. I probably will tend to go with a natural choice first, right? I'll do my honey, I'll do my ginseng, my echinacea. And then when it kind of escalates or when it gets to a point where I feel like, all right, I need something a little bit more potent, I'll tap into some prescription medicinal products too.
Okay.
Mm-hmm.
And I see we have a response here. Destiny says that you used to be 100% natural herbal, and over the past few years, you've moved more into pharmaceuticals, which is interesting. So I think over time, people probably maybe do a little bit of research to kind of see what works best for them, and they lean more, you know, one way, or can, you know, be a combination of both. I'll say for me personally, for mental health needs, I will say that I lean more towards the herbal and more homeopathic remedies. So I'll do like my essential oils, my teas and things like that. But for medical reasons, I will probably stray a little bit closer to the pharmaceuticals. I will say like medications and things like that, whether it's prescription or not, just because of some of the effectiveness, I'll say, in regards to both. So and which we'll speak about effectiveness when it comes to medication and herbs as well. Okay, so thank you for everyone who shared. So let's get right on into the conversation. So why is this conversation important in the first place? Why does this conversation matter? So kind of a little bit like we spoke in terms of medication, there is a foundation, as you can think, right? Like before medication was even thought of, before it existed, if you think way back when, you know, historical times, there were communities in Africa, in the Caribbean, in indigenous nations, in Asia, and across the Americas, where, again, medication didn't exist. And so people had to rely on herbal remedies to either heal their ailments or to take care of whatever they were struggling with, right? Illnesses and things of that nature. And so this was considered to be like the original healthcare system, because modern healthcare did not exist at that time, right? And so, of course, as Western medicine developed, many traditional practices, so the homeopathic remedies, the herbs and things like that, were deemed to be unscientific. And so they were ultimately restricted and not seen as the go-to way to address your mental health or medical needs for that matter, right? Now, there are a lot of communities, especially communities of color, that were relying on whether it's leaves, teas, tinctures, and things of that nature to address their ailments, their illnesses, and things like that, where now that Western medicine was kind of overpowering that, there sometimes was a little bit of now a mistrust in the more modern healthcare system. And so there's been a little bit of a barrier in regards to that, which we will speak about in a little bit. Now, in terms of generational trauma, right? I wanted to speak on this because I feel like it's important to speak on, again, in terms of like mistrust of the medical system and whether it's stigma. A lot of people have generational trauma when it comes to medications and healthcare. For example, again, as a therapist, I've seen clients who were like maybe forced into seeking therapy when they didn't really want to. So that kind of created like a bad taste in their mouth when it came to therapy, or if they were forced to take medication, right? And so now as they're older, there's a little bit of hesitancy or ambivalence when it comes to taking medication or just the healthcare system in general because of some of that generational trauma, right? And of course, if anybody has any questions, please write them down in the chat and I'll make sure to check that every once in a while. Okay.
Yeah, I think also, Renee, I think it's important for us to mention as well as healthcare providers, the modern medicine, has failed various groups of people various times throughout history, right? So whether that is Tuskegee or Henrietta Lacks, or in psychiatry using non-consensual therapies and so forth on patients, or even as we see nowadays, the huge disparities in things like the mental health prescribing practices, or maternal mortality. These things are real and have created this mistrust. So it's as I said before, it's valid that people have these feelings towards medications or towards healthcare and or mental health treatment in general.
Right. And to add to that, I mentioned generational trauma. I kind of want to add vicarious trauma as well, in terms of, even if people may not have experienced this mistrust directly, hearing stories of, whether it was their parents or their grandparents or this person on TV or whatever the case, that can also add to that mistrust, where now you're hearing things like, well, I don't want to take medication. That means I'm crazy, or I don't need therapy because something's wrong with me, or, I'll just go to church, or I'll, pray, or, read the Bible, or whatever it is. And I want to make sure I'm prefacing that I'm not knocking any religious stances, but also speaking of the importance and the benefits of the healthcare system when it comes to therapy, medication, or herbs, whatever suits that person. And I also want to speak on the importance as well of seeking a healthcare professional of color who might be able to speak more towards some of that mistrust, validate some of that mistrust, and be able to hear concerns and make sure that you, as the client, the patient, are being heard, whatever concerns that you may have, to kind of break down whatever barrier might be present. Okay. So I do have another question that I do want to put out there. And so I want to ask, in terms of, again, I mentioned a couple of, statements that people probably have heard often. I don't want to be dependent on meds. If I have to take meds, I'm crazy. I'll just go to church. I don't need that. People of color, we don't need that. So is there a statement that any of you have heard the most? So whether that be, 1, herbs are safer than medication. 2, medication means something is wrong with you, like I mentioned before. 3, therapy should be enough. Or 4, you've probably heard a combination of either 2 of these or all 3 of these.
I would say for me, medication means something's wrong.
Mm-hmm.
Yeah, I've definitely heard that as well. All of them. Yep. And I think, the important piece of this conversation is making sure that we discuss all of these things, because they're not necessarily accurate. Okay, so we want to make sure that we're being transparent in addressing some of these things and these misconceptions that people have. Okay, let's see. So getting into herbal remedies. So I want to preface and just kind of say, when it comes to herbal remedies, how I got into getting interested into learning about herbal remedies, and then also providing and offering herbal remedies to individuals that I work with. So in the 10 plus years that I've been working as a clinical therapist, I've worked with a lot of clients who, again, have some type of mistrust when it comes to the healthcare system. And so there's a response of, no, I don't want to take medication for my anxiety. No, I'm going to have to, be on it forever. No, I'm going to have side effects. I'm going to feel like a zombie, and, all the things, right? All of these stereotypes, I guess I'll say, right? And so as a result, I figured, well, you know what? I'm seeing a trend here that a lot of people are hesitant. And because I do not have the medical background to give the information that more accurate information about medication, I decided, you know what? Well, let me look into herbal remedies, right? Something that people may be potentially a little bit more open to, especially because I wanted to go that same route for myself, right? So like when it comes to headaches, you know, being able to use essential oils on my temples as opposed to taking ibuprofen, right? So if it could help me, sharing that information with others. So I then got a certification in herbalism, which is how I'm allowed to or able to provide this information to you guys. So again, when it comes to herbal remedies, now there are a lot of common herbs and natural resources that we can use. For example, garlic and ginger. These are things that, you know, regular household items that people may use to cook and things of that nature, right? Both being anti-inflammatory, right? Or with onion being antibacterial. And those are for more medical purposes. But there are a line of herbs that you can use for mental health purposes, right? And so, for example, we have chamomile and passion flower. Right. I know a lot of people are very familiar with chamomile tea, right? So chamomile and passion flower are both very much so able to help with anxiety, sleep, irritability, right? We also have valerian root. Valerian root is another herb that can help with sleep and giving a person like a calming effect, right? To make them feel more calm. We also have holy basil, which is also called tulsi. And then we also have peppermint, which those can help with focus and mental clarity, okay? Now, I do want to be clear and say that these can help with these symptoms, but not necessarily cure symptoms. So I want to, you know, preface and provide that disclaimer. Now, a lot of these herbs used for your mental health can be used either internally, whether it's for teas, tinctures, which tinctures are just liquid extracts of the herb. So in case a person doesn't want to drink tea all day, especially if it's hot or whatever the case, you can just kind of put a couple of drops of the tincture under the tongue and it'll kind of have a similar effect. So teas, tinctures, or honeys internally, or if you wanted to use any of the herbs externally, you can use them as oils, balms, so like a lotion or something like that, or a poultice or a compress. So poultice is kind of similar to a compress, but we won't get too much into the specifics of what poultice and salves are because that's a conversation for a different webinar. So again, all of these herbs have a lot of benefits. They are gentle on the body. They can be very supportive. Some of them have calming effects. They can have minor side effects, but I do want to get into in a little bit the fact that there can be side effects, which is something that we definitely want to take note of, okay? Now, there are also limitations to herbs. So I don't want people to think, oh, I can just take herbs. I don't have to take medication. If I'm scared to take medication, let me just do herbs, because you want to make sure that you are educated in how you're taking them, because again, there are limitations, right? So it's not necessarily immediate in terms of the effectiveness. Herbal remedies are more so of a lifestyle, I would say. It's something to kind of repeatedly or regimentedly stay consistent with over time, right? So you can't just kind of drink, you know, a tea for inflammation one day and think that it's going to solve all of your problems, right? It's something that you have to repeatedly take to help with whatever the issue or the ailment is, okay? It's also, herbs are also not a replacement for medication, which Michael will speak a little bit about medication and the importance of that in a little bit. And in terms of limitations, herbs are not recommended to be used when you are experiencing severe symptoms, okay? So herbs are, you want to think about herbs in the sense of, I don't really need to go to the doctor. I can still go to work. I can still function for the most part, but I'm struggling in a minor or maybe moderate way, then herbs might be potentially good for you. But if you're thinking moderate or you're experiencing moderate to severe symptoms, then we might want to look at medication, okay? Of course, at the advice of a healthcare professional. In terms of safety, when it comes to herbs, again, it is important to speak to a qualified professional because you want to be mindful of the dosage, right? Dosage matters, similar to medication. You also want to know if the herbs might have any contraindications. So in terms of if it's advisable for you, depending on if you have high blood pressure or whatever the case, that's something you have to be mindful of. or if it has any side effects or interactions with other medication. For example, if there's a person that is on blood thinners, I would not recommend that they take, or is actually not advised that they, consume St. John's wort, which is an herb, okay? Because it can have negative interactions with the blood thinner. So, you can't just go to a store and take a certain herb because you heard that it can be helpful. You want to be educated before you are consuming anything, okay? Whether it's internal or external.
Yeah, and Renee,
Michael, is there anything you want to add?
Yeah, I'll definitely speak to that one. Many times I see patients in, the acute care setting, and they completely, I don't want to say forget about, but don't think about that herbs may also play a part in whatever reason that they are here today, right? And so it's very important to make sure that you're when you talk to your healthcare professional, to make sure you kind of, add those little tidbits in, because, just like any medication, also any herb can also have, some side effects.
Right. So to your point, being able to, I know when I go to the doctor and they ask, oh, are you taking any, vitamins or supplements? I make sure to list everything, right? So that they can have a full, clear picture of what I have been consuming, to make sure in terms of any, symptoms I've been experiencing or whatever the case, they have that full picture.
Yeah.
So yes, absolutely. Good point. Any questions so far, or anybody want to stop? Or can I keep
To
going?
Michael's point, I think because of how herbals are regulated and how available they are, right? Like, it's over the counter. It's something you can go in any store and pick up. If you go into, what's that one store off Moreland? 7 Under, right? There's a whole smorgasbord of things, and there's really no one to stop you and say, hey, you can't purchase that, right? So we kind of almost equate it with food, maybe, right? Whereas a prescription, that's a whole process. That's going to a physician's office. They have to screen you. Maybe labs are taken, questions are being asked, and then you have to get the script to go and get it filled, right? So it's more of a regulating or a slowing down process with prescription medications, where natural products can become harmful because there's no slowdown. I heard this online. I saw this on TV. My aunt said she took it.
I saw it on TikTok.
Right. Not even paying attention that, I also go and have dialysis, or, I have, liver issues. So I'm not paying attention to how much I'm taking in. And this is also creating, like, compounding the problem, say it that way.
Yeah, I agree. And I think that's part of the reason too why I wanted to educate myself on herbalism, so that I could share some of that information. You wouldn't believe how many times I've heard people say, well, I heard this on TikTok, or I saw this online, or this person said that it worked for them. And then they try it and then maybe have a side effect or some negative reaction because of something that's not necessarily regulated, right? So yeah, it's very important for people to be mindful. And I hope that, us with this conversation and other people as well can share information with people so that they can have the accurate information to take their precautions.
Exactly. And you mentioned something earlier too, or you started to allude to, we back in the day, or for a while, right? Our people have kind of leaned into natural products. We used it, whereas I guess on a maybe not necessarily broader scale, but what might have been said was there's no science behind it. When in fact, Michael, we know that a lot of our prescription medications are derived from natural products, or things that are mimicking what our own body does, right? Chemical hormones that our own body naturally has. So I think it might be interesting to kind of dispel that myth, right? That there is science, right? Because the science is using what was provided in nature, what is provided in nature.
Right. Right. And I think, to dispel some things that people have been thinking where it may or may not be accurate, that kind of is a good segue into talking about some of the myths about herbal remedies. So a lot of people will automatically assume, oh, herbs, you grow them from, the earth, and they're all natural, and so they must be safe, right? And so, like I already spoke on a few minutes ago, that may not always be the case, because medication or herbs can have interactions with antidepressants, with anxiety medication, again, with blood thinners, like I mentioned before, with birth controls, etc. So you really want to be mindful and not always just think that, okay, because herbs are natural, that they're always the safest route for you, depending on, what the person may be experiencing. Again, Camilla, you mentioned the lack of regulation with herbs, and so they are not, herbal remedies are not FDA approved. So because there is that lack of regulation, again, a person will definitely want to make sure that wherever they're getting their resources from when it comes to herbal remedies, that this person is a qualified professional to share that information. Another myth about herbs is that herbs can cure trauma, treat depression, bipolar disorder, or other mental health concerns. And again, as a clinical therapist, this is not accurate, right? And so not to say that it can't help to address some of the symptoms a person may be experiencing if they are experiencing sadness, if they are a little emotionally dysregulated, right? But it's not going to necessarily cure, like I mentioned before, it's more for minor to somewhat moderate symptoms. But once we're getting to moderate to severe, we want to look at alternatives. Okay, so herbs can help support regulation, but they don't really replace more clinical treatments. Another myth that I've heard is that, like we spoke again before, oh, it worked for somebody on social media, like they use this and they saw these results, so it'll definitely work for me. And like we said before, this is not a one-size-fit-all conversation. And so herbs are not a one-size-fit-all remedy for everyone. Okay. Now I'm going to hand it over to Michael because we are going to switch talking about prescription medication, and that is not my area of expertise. So Michael, I'm going to hand it over to you.
Sure. So, I'm going to take over, and we're going to talk generally about prescription medications. Initially, what they are, how they work, kind of how it works in your body, right? To dispel some of these myths, right? So similar to what Camilla said just a few moments ago, is a lot of our prescription medications are actually derived from natural processes that happen in our body already, or from natural products that we have derived a synthetic, version of them, right? And so when we talk about psychotropic meds, so whether that be antidepressants or meds that you use for anxiety or for mood stabilizers for bipolar, manic stages, most of them all work on your neurons, right? So inside your brain, you have these neurons that release neurotransmitters, okay? Once they release these neurotransmitters, it is a goal for them to bind to another neurotransmitter, right? To elicit whatever effect that may be. So it could be, improving your mood. It could be giving you some type of stimulant effect. It could be helping you with sleep. But is their goal to bind to those receptors to do that? But naturally, our body will take those neurotransmitters and kind of store them back again, right? And so once they're stored back again, our body can't use them for those purposes, right? So when we think about a lot of our psychotropic meds, what they actually do is they allow those neurotransmitters to bind to the receptors that they need to bind to and to be around a little longer, right? And so that is a natural process. That's a process that's already going on in your brain now. These psychotropic meds really just help to kind of optimize and improve that process, right? And so, I think one big piece of that is it really helps people understand that this is not a foreign process that is happening when you're taking a medication, right? Now, of course, there are, maybe side effects with those medications. There are best practices on how you use those medications, but as you're using those with your healthcare provider, and if you are using the right healthcare provider, which, kind of going back to your point earlier, Renee, I think it is important to have healthcare providers that understand you as a person, who may come from, similar culture, who may come from similar race, similar background, and so forth. I can tell you myself, I have, 3 check boxes when I look at a provider, all right? They have to be, Black. They have to have gone to HBCU undergrad, and preferably if they went to a HBCU for grad school, medical school, whatever else, okay? I know it's crazy, but you know, that's for me, right? And so
Mhm.
I think it is important for you, for any patient, to understand that you have, you know, a level of control and, you know, should have a level of trust, you know, with your providers. And, you know, that doesn't mean you're always going to pick the, you know, right provider the first time, but you have that ability to say, hey, you know, I think I'm going to try, you know, someone else. So when it comes to these psychotropic meds, it is very important that you have the healthcare provider who you trust and you have, you know, some type of rapport and relationship with, so that you can use these medications properly. I think, especially for myself in the acute care setting, I see patients many times who, you know, maybe they've gone to, you know, a few different psychiatrists or a few different, you know, doctors, and they've given them multiple meds when, you know, they may not have needed to be on all those, right? And so, you know, having someone who can, you know, kind of be in your corner to say, you know, let's have a second look at kind of what's going on. Let's maybe try to optimize what we're already using instead of, you know, throwing on other medications. And, you know, kind of a shameless plug, that is, you know, why, you know, myself with Into Touch Wellness, that's why I'm here to help, you know, kind of be that second eyes in our practice for, you know, our patients to say, are there potentially other avenues that we can go to?
Yes, well said. Thank you, Michael. Camilla, I don't know if there's anything that you want to add since you're gracing us with your presence.
I think so. You know, Michael, what you talked about was like safety, right? It makes perfect sense to me. It doesn't sound crazy to want to go to somebody that looks like you, that has kind of walked your walk, right? You going to an HBCU, you being a medical professional, right, given our history, you guys talked about Henrietta Lacks, there's eugenics, there's all these different doctrines that their idea was to kind of make things better, but better for whom, right? Because it hurt such a big, broad group of people. So that finding something that feels safe makes sense to me. And then also I enjoyed hearing you say, like, you're a voice to clients at Into Touch Wellness, right? Bringing your expertise in medication education and counseling is paramount, because to have that touchstone, to have that where I don't have to necessarily wait for, you know, an appointment way down the line to meet with somebody. I'm able to access my pharmacist and actually talk to them about things that I don't really feel comfortable or feel like I have the time to talk about in a physician's office. So I think being able to take what you know, right, all the details and the some of the language that might seem too big or go over someone's head, and be able to break that down, I think is so important to certain populations that just don't feel like they're heard or get that touch time, that support in that way.
Yeah,
Mhm.
absolutely.
Yeah, and I definitely want to add too, from a therapist standpoint, that I have the similar experience in terms of I've had many clients that come to me and say, okay, well, I saw you out because I saw your profile picture and I saw that you were, you know, either female or African-American female, and that resonated with them before they even heard me speak. Right. And so to be able to have that connectivity, that relatedness, you know, of course, our stories are always going to be different, but it kind of helps to bridge the gap just that much more to see that, right? And so that's always been an experience that I've had with clients as well from a therapist standpoint. And then myself as well, when it comes to my healthcare professionals, I definitely will prefer someone who is of color, ideally. I can't always get my way with that, but that is a preference of mine as well. So we're on the same page with that.
Yeah.
Okay, so for the interest of time, Michael, did you want to go over some of the myths about medication? I mean, I think we kind of already spoke a little informally about them, but if you wanted to kind of speak a little bit more towards some of the common things that you guys are hearing in regards to the hesitancy around medication.
Yeah, well, I think just in the interest of time, I'll list some of these things that, you know, I've heard, and, you know, you all can just tell me if you've heard them as well, or, you know, anyone on a call if you've heard these as well, or even thought these yourself, right? So number one, you know, kind of taking medications makes you weak. Number two, once you start, you know, you can never stop. And then number three, kind of piggybacks off that, but, you know, antidepressants or psychotropics, they're, you know, addictive, right? And then we'll also talk about, you know, do psychotropics really just mask symptoms, right? And so, I'll speak just briefly on all these and just say that it doesn't make you weak. Again, this is a natural process that's happening in your body, and there are times when we need support. That support doesn't necessarily have to be, forever, right? That support, may come from therapy or from, mental health providers, but that support may also come from healthcare providers and medications. So it has nothing to do with weakness, right? It just has to do with you yourself, taking some action to improve, I would say, whatever's going on in your life, right? Number two, once you start, you can never stop, and that they're addictive. So you can stop, right? So you will have to stop under the advisements of a healthcare professional, right? Most of them usually, take some time for you to be able to stop. We will essentially what we call wean down. So, use lower doses over time in order to get you off of them. And that's just because this is a natural process in your body, and your body can find ways to regulate or move back and forth if you stop using them too quickly. And they are not addictive. So when we think about addiction, when you think about medications like opioids and so forth, they do not elicit the same effects that those medications do. And as long as you have titrated them down slowly, you will likely not have kind of any unwanted side effects, right? And then lastly, do they just mask symptoms? I would say no, right? But it is also important that whatever the root cause of those things are, that you also have them addressed, which is, again, why I also believe that therapy is very important as well. So, tying in that therapy piece as well as the medication piece is very important, so that as you are going through life and you are experiencing these challenges and so forth, you have the tools to be able to solve them, not just mask them. In healthcare, sometimes providers will give you medications to mask them, but it's important, again, for you to have those advocates to help alleviate those problems.
And I think, in terms of, so Michael, you're speaking on the process when it comes to taking medication, that it's not something you're supposed to be on for the rest of your life, which I too have heard that from a lot of clients of mine in terms of their hesitation with taking medication. So what I usually, or how I break it down to them in terms of mental health care, whether it's therapy, medication, a mixture of both, is I explain it to them in this way, right? In this process. So, and this is, my clinical expertise. Other professionals may have a different process that they kind of go through, but I see it as a client starting therapy first, right? You come to therapy, you have a concern, you have an issue, you have something that you are struggling with, right? Whether it's emotion management, if it's depression, if it's trauma, whatever it may be, right? And so after a few sessions of working with that therapist, both you and the therapist, because it is a collaborative process, right? Both you and that therapist will determine, okay, well, is talk therapy not enough, right? Are we looking at something more severe, more something deeper that may need to be addressed? And so that then that referral, the provider will provide that referral to psychiatry, right? To be able to see if medication could be a good option. You meet with that psychiatrist or that prescriber to see, whether it's a nurse practitioner or whatever the title may be. They will then prescribe something, you will start taking that. And as you are taking that medication at whatever dose it is, you are still participating in therapy, right? So that you are able to, kind of like what Michael was saying before, that you are getting to the root by using the therapy, but you're also stabilizing the symptoms by using the medication to help you do that, right? So you're still able to function and go to work and take care of kids and do all the things, right? And so eventually, like Michael said as well, once that stabilization is displayed, you'll start to wean off of your medication, right? So if you're taking 50 milligrams of something, you might go down to 25. I don't know what the increments are. Again, this is not my area of expertise, but you wean off eventually while you're still doing the therapy. Then eventually you'll stop taking the medication, right? Because you're at a point of stabilization where you're able to now move forward and really take in the benefits of the therapy and get to that root and now function more adequately. And then eventually you stop the therapy, right? In terms of like a way to kind of like compare it or use like an analogy, sometimes what I'll say is it's kind of like, let's say if a person has an injury, right? Let's say if they have a knee or ankle injury, or they have surgery or something like that, right? They're going to go to physical therapy, right? And so you're going to go to physical therapy, and then you might take medication for pain, right? So you kind of want to think of therapy, the mental health therapy, as the physical therapy, right? The physical rehab. And the medication for the pain is kind of like the psychotropic medication that you may be taking for your mental health, right? So again, when you're thinking about the injury, you're going to take the medication for pain. Eventually, you're going to stop, but you're still going to rehab. You're still going to get that PT. You're getting whatever rehab it is. And then eventually you stop the medication, but you're still doing the rehab to the point where, okay, you know what? I can walk again without needing to go to rehab. And so that's kind of like the trajectory or the process in terms of mental health care and medication, if that makes sense. Okay, that's kind of how I like to explain it to people, because I actually have a lot of questions. People confused as to what the process looks like. Okay,
I want to
so
include some of those people who don't get to come off of it, right? Who do have to be on it for a longer period of time. I love the broader message that you guys are sharing tonight, that it's okay because it's adjunctive, it's synergistic, it's something that they go hand in hand, right? If the medication can kind of help what the body may not be producing as much, right? Or whatever the deficiency might be, or again, to get you stabilized, that the medication is there as a helping hand, right? Not to be a sole product, but some individuals don't necessarily get to come off, and that is okay too, right?
That's good.
yeah, and
Mhm.
what that would necessarily look like for anyone that may be wondering is, again, when we're talking about the symptoms or the behaviors that a person, or diagnosis that a person may be experiencing. So I usually tell people that when it comes to diagnoses such as something along the lines of psychosis, right? So if a person is experiencing like hallucinations or something like that, that may be a person potentially, again, it's not a one size fits all, but that person may be on more of a long-term journey when it comes to prescription medication. And again, like Camilla said, that is okay. It's making sure that the person is stabilized enough so that they can adequately function in their regular day-to-day. So again, one size does not fit all. It kind of depends on the person and what they're experiencing. So thank you for that addition. So to kind of summarize again the difference when it comes to herbs and medication, herbal remedies can help to regulate some symptoms that you may be experiencing on a smaller scale, but meds are more effective when it comes to stabilization, so that, again, you can function more so in your day-to-day life, right? Sometimes both may be necessary, sometimes one may be necessary, but you want to make sure that you are speaking with a qualified healthcare professional. Again, if one of color is something that you think could be helpful for you because of the racial or historical context behind that, that can definitely provide some benefits. And again, herbs and meds are best used as a bridge to kind of help with therapy if you are taking therapy. Again, like Michael said, because you kind of want to get to the root, right? And kind of a little bit of a plug into, the name of my business, Core Psychotherapy. That's kind of where I came up with the name Core, because when it comes to therapy, mental health, you want to get to the root of what's happening, right? You don't want to just, okay, well, I'm feeling this. Okay, well, why am I feeling this? We got to get to the root. And sometimes the therapy can help you get there. Okay. Let's see. So we are going to do one last, I guess, poll. Well, actually, before I get to the poll, I did want to give a few more tidbits in terms of, Camilla, you already mentioned this, in terms of, the medication that a person may take and how long they take it, again, will depend on the diagnosis or the symptoms that they are displaying. I also want to make a point, because I actually posted a TikTok recently, I want to say about a month or so ago, and I referenced the fact that if a therapist is recommending medication at the first session, that's kind of like red flag for me, right? And then a person did comment and say, I disagree with this. What if the person has severe, behaviors or, something like that where medication might actually be warranted. And so I said, you're absolutely correct, right? So I want to be clear and say that when it comes to if you are starting your process, your mental health process with a therapist, there are going to be differences in if and when medication is going to be recommended. It could be recommended initially, depending on the severity of what you are bringing to the therapy room, or it could take a longer process just depending on what's occurring. So again, not a one size fits all conversation. Okay. Again, Michael had spoke on the importance of the healthcare professional that you are seeing. Remember that you are hiring these healthcare professionals, right? So you are coming to them. If you have insurance or pay it out of pocket, you are taking your time to seek their expertise. And if you feel uncomfortable, if they're not allowing for you to ask questions, if you're unsure of something, or they're only speaking in medical jargon and you're so confused, you should feel comfortable to ask questions. You should feel comfortable to seek a second opinion if that's something that you feel may be necessary as well. You know your body, right? So you want to be able to, yes, listen to the professionals, but also get second opinions if you feel like it's needed, but also ask questions if there's a level of, again, I've had experiences where I've gone to the doctor and they're using, medical jargon, and I'm just like, okay, wait, what? Can you wait, hold on, go back a second. Can you explain that to me? Because it can be confusing, right? So as long as you feel comfortable, you want to make sure you feel comfortable with your healthcare providers to be able to have that dialogue. Okay. So we are going to actually wrap up here. We're going to have a quick section for a Q&A. But before we do, I want to actually, do we want to do the prize question? Do you want to, see who may potentially?
Well,
So we do
I
have
don't feel like your presenters can win the prize. So if Jacinda and Leah are up
okay. I mean, well, what I can do is that we can still ask the questions. I see a last name here that looks familiar, so I think there's a family connection here. So I don't want there to be any cheaters or anything like that. But just we were gonna have a quiz, I guess, at the end to kind of just test knowledge, because I think the thing that we said that's really important with this conversation is making informed decisions and knowing where your options are, as opposed to just seeing something online or someone else did something that worked for them. And so the questions, I'll just kind of say them. So one, herbal supplements are not FDA approved in the way that medications are. So we want to be mindful of that, right? Any herbal products that you do consume, they should state that it is not FDA approved. Okay. And if it does not state that, there's a little bit of a problem with that. Okay. Because they're not following regulatory guidelines. Okay. And then the other question was just, what factors should always be considered before starting herbs or medication? Multiple choice question. A, that it worked for somebody else. B, the cost of the medication only. C, the safety and the individual needs for yourself. Or D, social media trends, which again, to Camilla's point, you guys probably know the answer, that it is safety and individual needs. Like we said, not a one size fits all conversation. I think that's the theme for this conversation, not a one size fits all conversation.
Mm-hmm.
So to wrap up, before we get to the Q&A, I did want to share contact information, which I'm not sure if the individuals on the call currently already have this information, but I will still share just for the sake of this recording. Give me 1 second to share my screen. Let's see, because I have a million tabs open. So I will leave this up for a little bit. Give me 1 second. Okay, so just contact information for myself. Again, Renee Anorue, founder of Core Psychotherapy. So website, email, phone number, social media. And then also if you wanted to sign up for the email list where you'll get emails periodically with different mental health tips, tools, resources, information that I may have about some of the products that I have to offer, any updates or anything like that. And then Camilla, Michael, do you guys want to share the information that you guys have for Into Touch Wellness?
Yeah, so our contact information is listed there. Into Touch Wellness is designed to bring care to adults 18 and older, struggling to manage wounds from trauma. So that can look like, namely PTSD, anxiety, and depression is where we really specialize. We also work with couples, and Michael brings his expertise in the medication education and counseling piece. Excited to also bring ketamine assisted therapy starting February. So to continue the conversation about how whether it's natural remedies or medication can be a great assist, right, to the talk therapy space, to the whole picture of wellness and getting you back in touch.
So if anybody wanted to write this information down, take a screenshot, take a picture, so you have that contact information in the future. I did also want to mention again, in the realm of speaking of homeopathic remedies and herbal remedies. So again, I got into this practice initially because of myself wanting to take more of a herbal approach, but then also crafting and curating herbal products for clients, but then also for just the public. So I do offer a line of herbal teas, herbal tinctures, essential oil roller balls. And I actually do have a anxiety e-journal, which I will be sharing with you guys. You're actually the first to hear this information, but I'm turning the e-journal into a physical journal. So just in case if, you know, people's preferences, I know a lot of people prefer to have pen to paper, right? So I do have those products, and I will hopefully be coming out with a few more products this year as well. And just to kind of speak a little briefly on what my products do or what they help with. I have teas that, the Core Calm tea that helps with promoting a sense of calm. So if anybody is experiencing anxiety, difficulty sleeping, it can kind of help with that. I also have a tea, the Core Comfort tea, that helps with if anybody's experiencing menstrual discomfort. It helps to support the endocrine system, and it has a few other potential benefits. I have the Core Calm tincture, which is very similar to the tea, just in tincture form. I have actually two new products that I haven't really marketed much on social media because life gets busy, but I also have the Core Clarity tincture, which that one helps with mental clarity, focus, and non-caffeinated energy, right? So I know some people actually want to refrain from caffeine. Caffeine is actually connected to anxiety a lot of the time. And so, and I know that from personal experience. And so to create a product that can help with sustained mental energy without that jittery kick from the caffeine. And I also have roller balls, essential roller balls that kind of help if you're not looking for anything to take internally, you have that externally, and then the anxiety journal as well. Okay. So I'm going to stop sharing.
Renee, I wanted to share, Jacinda had shared with the group that she is a pre-doctoral clinical psychology intern. So congratulations to you, Jacinda, on that road.
Yes.
Right? I'm pretty sure you've done a lot and continuing to do a lot. So I'm excited about that.
Mm-hmm.
And she too is doing ketamine-assisted psychotherapy. So just in the stay in touch. Where are you? Are you in the Maryland area, the Georgia area? If you don't
Yes, I'm definitely in the DC area. So I currently attend the Chicago School of Professional Psychology, but right now my internship is at the Mid-Atlantic Internships Consortium. So still local in the DMV area, but this has been really interesting and very helpful. I noticed my line sister posted, I think, the link to the webinar. So I was like, I do have some free time after seeing clients today to just hop on and listen in. So it was really nice and interesting.
Thank you for joining.
Nice. Yes. Thank you. Thank you. Appreciate your attendance. And yes, definitely good luck with your internship in your program. Okay, so I did want to open the floor up to if anybody has any questions or even comments in terms of experiences they had personally, or if you know of anybody, just to kind of speak towards, again, a lot of what we're talking about, whether it's myths or dispelling myths or your own experience with healthcare providers or what have you. If anybody has any questions or comments.
I will say I really enjoyed this conversation. I think this is a really good introduction to a conversation that needs to continue. And what I took from it is that there is a place for natural products. There's a place for prescription medication. There is a space to feel okay that you want somebody to look like you and your physician or your provider to look a particular way that is okay, right? Renee, I have bought your Core Calm tea, right? Is that what I purchased? And I enjoyed it.
I believe so, yes.
Yes.
Oh, thank you.
I met you when I was like, I think, when was that? when was that? That was maybe
like
September.
September, October or so. Yeah.
So I was getting towards the end of the year where the bandwidth was going like this and like this. And like this. So not really anxiety or problem sleeping, just being calm though. So
Right.
I can speak to your T doing that.
All right. Thank you. I appreciate the testimonial.
Absolutely. I enjoyed everything that you guys shared today. And I'm so thrilled to have Michael with the practice. And Jacinda, I'm excited for you, really excited for you. So please stay in touch. And hi, Leah.
So, Michael, any last words, comments?
No, I think my last words would be just to kind of stay informed with your healthcare provider. Again, it's okay for you to have someone who looks like you or understands you. And definitely thank you, Renee and Camilla, for thinking up this idea and inviting me on and so forth. So I definitely appreciate it, and it is a conversation that needs to be had. So we need to make sure we share this message, throughout all the platforms.
Agreed.
Absolutely agreed. Okay, well, thank you, everybody. Definitely special thanks to Camilla and Michael for assisting me with having this conversation and being able to share this conversation. Thank you to everyone who popped in, popped out, and just having your attendance. And I think, again, I agree with you, Michael, that this conversation is definitely needed so we can kind of help people see the more accurate side of herbal remedies, but also medication, again, because of some of that mistrust, no matter where that mistrust comes from. So thank you, everybody. Enjoy the rest of your evening and Happy New Year.
Thank you. Happy New Year.
New Year's.
Bye, everyone.
How do you feel?
Well, I had a feeling we were going to go over 45 minutes. I know myself, and I know I can be a talker sometimes. Well, actually, hold on, stop recording.